My name is Michelle. I'm coming at you live and direct from Dr. Kim Lucas Benton's office, Vista Pacific Dental, here in Daly City. And I am going to be explaining some of the proper ways to use the Rotadent periodontal instrument and the use, which is basically to prevent and control gum disease. So we'll go ahead and start by showing you some of the techniques. One of the main things we always tell our patients to remember is to use the W and M method while brushing. What I mean by that is you always want to brush one arch at a time, and because of the way the Rotadent is shaped, like the instrument that we use to scale your teeth with, it allows you to reach in those far places, like all the way behind your molars here. And what we mean by the W and the M's are you want to basically start in your back tooth all the way behind the molar, and then you want to do the letter W. You want to go down your gum line and up in between your teeth. Down the gum line and up in between your teeth, all the way around like a letter W. So you want to do that until you get to the end of your arch, and then you don't want to forget the insides of our teeth. A lot of us, really pay attention to the outsides, but we need to make sure we don't forget the insides. So you want to do the same technique, the W's. Down and up in between, down, up in between, all the way around. And what I do, I usually do my whole bottom arch, outside and inside, and then I go ahead and brush my chewing surfaces. Now, the good thing about the Rotadent is if you press too hard, it'll stop on you, and it's letting you know that you're putting too much pressure. We're all used to brushing our teeth really, really hard, but that's not the correct way. So it'll either slow down or completely stop on you. So then we're going to move on to our upper arch, where you're going to do the same thing, but you're going to be doing the letter M, and you want to start all the way in the back behind your molar. Focus on your gum line and down in between your teeth. The Rotadent has a brush tip with a very pointy head, and this really helps with patients that have not perfectly straight teeth, which most of us don't. So it really helps to get into those little nooks and crannies that our regular manual toothbrushes would normally not get into. So you want to go ahead and do your M's all the way around to the end of the arch, and then the same thing on the inside. And then you don't forget your chewing surface. And when I'm done completely brushing, I just go back around to my facings of my teeth, because I was so focused on the in-between that I want to make sure that I get those as well. The Rotadent also comes with a flat brush head, and this is probably best for patients with really straight teeth. And another good thing about the pointy is for patients with braces. It really helps get in between the brackets and the wires. Also, patients with crowns and bridges, it really helps clean those areas as well. So here in the office, we all actually prefer the pointy brush head. But the good thing about it, the Rotadent comes with both, so you can try both out when you purchase the Rotadent. And there's a 2-year warranty. The brush heads last about 3 months each, and then so every time you come in for your 6-month visit, you can buy 2 more brush heads. We do have them here in the office. You can pick 2 pointies, 2 flat, 1 and 1, whatever you prefer. So now I'm going to go ahead and play a short clip for you on periodontal probing. So to help you guys better understand how we diagnose gum disease and to understand the numbers that the hygienist calls out when she's seeing you for your 6-month visit.
Your dentist will examine you for periodontal disease using a periodontal probe. The probe measures the depths of the pockets between your gums and teeth. A reading of more than 3 millimeters is a sign that you may have some form of periodontal disease. Treatment of the disease depends on how far the condition has progressed. One of the most effective treatments for gum disease is periodontal scaling and root planing. For this procedure, your dentist uses a small scaler or an ultrasonic instrument to clean the teeth and remove deposits above and below the gum line. After Afterwards, the root surfaces are smooth so that your gums can heal. Your dentist may also place medication directly below the gum line to kill bacteria and allow the tissues to recover. In advanced cases, periodontal surgery may be necessary.
So now that you understand more about periodontal probing, I just wanted to mention one more thing about the Rotadent. So the bristles on the Rotadent brush are very, very tiny, very thin. And the important thing about that is when you're doing your M's and W's and focusing on that gum line, it allows the brush to get into any deep pockets that you have. And that's one of the main concerns when it comes to periodontal disease is doing your part at home and cleaning out those deep pockets. With manual toothbrushes and electric toothbrushes that you can buy at regular drugstores, look at the bristles. They're really thick, and that would really not allow you to get into those deep pockets. So that's it for my video and my demonstration, and I hope you all enjoy the testimonials from some of our patients who really enjoy using the Rotadent toothbrush.